I have this patient. He came to me a little while ago, and he was dealing with a lot of water retention. And typically, water retention happens in the lower extremities. Typically, it's the knee down. Sometimes it's all over the body. But in this case, the water retention was really in his ankle, he's in his feet. For years, actually, he was dealing with it, and he saw different medical doctors, and he tried different medications like blood pressure medication, LASIK, water pill. I mean, he tried different things to help with the water retention, but nothing was really helping, and got worse over time. And when he came to me, he was in pain. He was not able to sleep good at night because it would get worse when he lay down. So the key here is to figure out what happened. So everything he tried in the past was just to mask the symptoms. So we need to go deeper, and we need to ask, why do you retain water? Medical doctors typically think about the heart. So if you have water issues, so it's the heart. That's why they try different water pill, different blood pressure medication. But 99% of the time, the heart is okay. And that's what happened with my patient is he did all those heart tests. Everything came back good. So his doctors didn't know what to think about it. So he just said, take this water pill and we'll see what happened. But over time, it got worse. So why do people have water retention? So one of the main cause, I should say, it comes down to an adrenal deficiency. Your adrenals are small glands that you have on the top of your kidney in your back. So the adrenals are in charge of electrolyte rebalancing into your blood. So meaning that if your adrenals are not able to regulate your electrolyte into your blood, you may actually have issue with water retention. The doctor will give them a blood pressure medication, a water pill, and so on and so on. So in his case, it was an adrenal deficiency. So his adrenals were really, really stressed, and he was not able to regulate the fluid, the blood flow. Because when you have an imbalance in the electrolytes, your blood is not flowing like it needs to. And then you have problems, fluid accumulations in your feet. You may have some numbness. Your feet might be cold, and so on and so on. So in this case, what we did is we gave him some vitamin C. So, vitamin C is the most important vitamin for your adrenals, meaning that your adrenals is the organ in your body that use the most vitamin C. And one of the problems I see with people is they don't take the actual real vitamin C. So I talked about it before is most people would get ascorbic acid from the store and it says vitamin C on it. But vitamin C is a complex of about 150 different components, and ascorbic acid is one component. So when you take ascorbic acid, you're missing the 149 other components, and ascorbic acid by itself actually can stress your adrenals over time. I've had people doing like vitamin C shot, which is ascorbic acid shot, of a high dose of ascorbic acid, and that can stress your adrenals over time. And there's some research showing exactly what I'm talking about. So for him, he had subclinical vitamin C. Doctors, people don't really think about vitamin C deficiencies because back in the days, people will die of scurvy. So scurvy is really a disease where your body is really, really deficient of vitamin C, and over time your body dies. So they figure out that if you take ascorbic acid, it helps with scurvy. But what they didn't realize is as you do that, people develop over time subclinical vitamin C. So the majority of people do not take enough vitamin C. One of the symptoms of it could be bruising. I see people regularly coming to me and they bruise easily, really easily. Or sometimes they have bruises, they have no idea why. That's a sign of subclinical scurvy. If you brush your teeth, for example, your gums bleed easily, that could be a sign as well. And water retention as well is another symptom of subclinical vitamin C. So what happened is when you're stressed, and God knows how much people are stressed these days. So when you're stressed, your body uses 10 times more vitamins than normal. So when people are really stressed out, they really use and deplete the vitamin C into the body, leading to adrenal deficiency. And this is exactly what happened to him. He had vitamin C deficiency for a long time, and every time he tried something, it didn't work because they never addressed the root cause of the problem. Actually, it got worse because of the medication, but I'm going to get back to it in a few minutes. So for him, I recommended a product called AC Carbamide. So it's a product from Standard Process that has vitamin C, for example. And this supplement is amazing to regulate fluid water retention in the body. So I call it the natural water pill. So it helps your body to flush out the excess of water into the body by regulating the adrenals and electrolytes into your lymphatic and your blood. So I said that his symptoms got worse because he was on a water pill. And the water pill, one of the side effects of it is potassium deficiency. So what ended up happening to him is he ended up on top of the vitamin C deficiency, having potassium deficiency because of the water pill. So for him, I gave him this AC Carbamide, which is vitamin C based, and I gave him some potassium as well to help the adrenals to work better. So as we did that, in a matter of few weeks, the body flushed out this excess of fluid, and the swelling into his legs totally disappeared. Okay, so AC Carbamide is an amazing supplement to do just that. And there's some herbs like burdock, dandelion. Okay, a lot of people see dandelion as a weed, but it's amazing to help regulating this excess of water of the body. I really love using as well horse chestnut, butcher broom. These are good herbs that you can try to flush naturally this excess of water. So vitamin C typically is the best thing to help your adrenals. And then I didn't talk about it, but vitamin C is needed for blood vessels. And like I said, most people are deficient in vitamin C. The great majority of people have subclinical vitamin C. And over time, they have blood vessels issue, vein issues, spider veins, for example. So all those circulation issues are connected to a lack of vitamin C. So it's really the key. And you get the vitamin C from your colored fruits and vegetables. And then organ meats as well has a lot of vitamin C, like liver, for example, or some people will eat the adrenals and so on and so on. So these are the best sources of C. And just pay attention to that. Just remember that if you have a lot of stress going on, you need to get more vitamin C into your body. Otherwise, you become deficient over time. So this is my two notes I want to talk about when it comes to water retention and adrenal issues. If you have any questions, please let me know. You can write a comment below. Otherwise, you guys have a blessed day. Thank you.